Hi, welcome to Detours Understanding Acquired Brain Injury. Today, this is the continuing series for essentials of acquired brain injury. And today we're going to talk about encephalopathy. Specifically, well, there are two types. There is encephalopathy that is caused by intrinsic factors, things internal to you, and there is encephalopathy caused by extrinsic factors. So this grouping, unlike the essentials of brain injury, where we talk specifically about traumatic brain injury, which is strictly external forces that are applied to the brain which cause damage, encephalopathy is more, it is direct damage caused to the brain. And some of this damage can be caused by either genetic factors or can be caused by problems with metabolism. So we're not going to be looking at that as much unless it is caused by something that happens to change what you've inherited, because a lot of those metabolic disorders are something you were born with, or something that is outside of what you'd consider acquired. And since the focus of detours and what we look at, it has to do with something where you've developed, as far as had a so-called normal development, and then something happened to change, so led to disabilities that were acquired later in life, even if that was at a very young age. We won't be looking at those as much unless you've done something or had something occur that caused changes in your metabolic processes. Now, this can be due to things like viruses or alcohol or anesthetics or medication you were prescribed. And this most definitely would be an acquired brain injury. And those kind of changes we will be looking at. But right now I want to talk about, and in what we're going to follow initially, we'll be looking at things like anoxic or hypoxic encephalopathy. And we'll be looking at toxic encephalopathy. And in this case, looking more at like industrial compounds. Well, one of our hosts, Brandy, was exposed to a toxic compound, volatile organic compounds, as they're called, and she developed encephalopathy due to her work. And a lot of people have, and there are all kinds of things you can be exposed to. And these disorders are better understood, but still not as well as, say, traumatic brain injury, because of a lot of complexities, including legal and legislative and factors like that. And so still there needs to be more research. Sadly, when it comes to acquired brain injury in general, a lot more needs to be done, because these causes are not quite as popular, and because there's often no like famous celebrity connected, although that is now changing with things like CTE and greater recognition of how they work. It's kind of a vicious cycle. So first of all, what is encephalopathy? So I'm going to read a direct definition for you so we can begin to talk about it. Encephalopathy is a broad term for any brain disease that alters brain function or structure. So it is considered a brain disease. Now, this does not restrict it to viruses, bacteria, fungi, any of those kind of things. However, it can, but it is broader than that. Encephalopathy may be caused by infectious agents, mitochondrial dysfunction, metabolic disorders, brain tumors, increased pressure in the skull, prolonged exposure to toxic elements, including solvents, drugs, radiation, paints, industrial chemicals, compounds, certain metals, chronic or progressive trauma, poor nutrition, or lack of oxygen or blood flow to the brain. So that's a very broad-ranging definition. And here are the ones we'll probably be talking about most. And here's a picture just listing for your, to look at. So toxic metabolic encephalopathy, TME, that's what we'll be looking at first. Then hypoxic or ischemic or anoxic encephalopathy. And that causes permanent brain damage when the brain doesn't get enough oxygen. This can result in permanent damage or dysfunction. Then the chronic traumatic encephalopathy, it's known as, CTE, you guys know about that. That is occurs with multiple mild or concussive, subconcussive injuries to the brain, leading to degeneration of white matter and throughout the brain. It's found in members of the military, football players, domestic violence survivors, anyone who takes repeated hits to the head. The toxic metabolic encephalopathy, TME, it's also known as CTE. It's the other CTE, chronic toxic encephalopathy. So you may hear it called the other CTE. Result of infections, toxins, or organ failure. When electrolytes, hormones, or other compounds in the body are off normal balance, they impact the brain's function directly and indirectly, and this can alter neuronal function and lead to neural death. Then there are infectious encephalopathies. We did talk a little bit about sepsis, but encephalitis and meningitis also cause these infectious encephalopathies. And then we're familiar with perhaps Wernicke's encephalopathy. Alcohol would fall under toxic encephalopathies, but Wernicke-Korsakoff syndrome and WKE, as well as just regular use of alcohol above certain levels, is neurotoxic. So these are considered kind of a little separate. And prescription meds. Certain prescriptions taken too much, or if you have sensitivities, they kind of interplay with your genetics. And so that is also causes harm to the brain. It causes an encephalopathy. Then there is hypertensive encephalopathy. If you have a prolonged period of very elevated blood pressure, that can do permanent neurological damage. A result of severely high blood pressure that goes untreated for too long. This can cause brain swelling. Remember how we talked about cytotoxic edema in this series back with brain injury, with traumatic brain injury. This also can cause permanent brain injury. Hepatic encephalopathy, liver disease. This centers around problems with ammonia and toxicity from building up levels of ammonia, which is related to these kind of the other CTE, toxic encephalopathy. You also glycine encephalopathy, which is more of a genetic condition, high levels of glycine in the brain. And of course, hypoxic and ischemic or anoxic, which I mentioned in the beginning, but a lot of things can cause that. And prolonged inflammatory. We're learning about inflammatory-based encephalopathy and the damage that your brain being inflamed due to all kinds of stressors. Even when we're starting to see autoimmune encephalopathy. So a lot of the autoimmune disorders where things like lupus or other autoimmune conditions like chronic regional pain syndrome can lead to autoimmune related problems. This is also an encephalopathy. Obviously, MS and other conditions can cause both direct as well as inflammatory. And so can emotional. Although this is not clearly defined as an encephalopathy directly, has those kind of effects. And we still don't know, and I don't know is an okay answer in neurology because we're still learning so much and have many questions yet that remain unanswered. So let's take a look, at least quickly, at some of the mechanisms of toxic encephalopathy. Here we see the basic mechanism for toxic encephalopathy, which has to do with what's called leukoencephalopathy. encephalopathy. But basically, here it's an attack on the white matter, and causes destruction of the white matter connections over time and causes them to break down. And as you can see, just like secondary injury for traumatic brain injury, when the white matter connections are broken, um, it disrupts the networks that are necessary, the central executive networks, the salience network. And when these are affected, you have problems with a lot of executive function, short term memory. You have problems with uh, working memory, which is connected. You also have problems with, a lot of people have problems with mood, shifting of mood. They have problems with focus and attention. They have problems with adynamia, apathy. They have problems, in some cases, there's been reports, problems with specific components of color vision, visual spatial processing. We will get more in depth with the next episode. We'll talk specifically about these problems, because the next episode will be just chronic toxic encephalopathy, and because there are different components that make it up. The three primary components for the pathophysiology, based on what you're exposed to, because there are a lot of different things a person can be exposed to, whether it is occupational exposure and legal illicit substances or illicit substances, and whether the exposure is through your job or through at home, like cleaning agents, or whether it's alcohol or marijuana, or, like I said, the illicit side, or whether it's illicit street drugs, and and it doesn't matter. The way it works in your brain is through these effects. And then I also want to talk about like how it affects socially, emotionally, how it affects your long-term life effects, and how genetics and things like that interplay. So that'll be what we do next. After that, I want to talk about anoxic and ischemic hypoxic encephalopathy. Again, the primary, secondary mechanisms of what unfolds, those kind of things. After that, then I want to start to talk more about just generally about some of the others, really about infectious encephalitis, meningitis in more depth, and pathophysiology, and how they are connected, how it affects socially, emotionally, those kind of things, and look at changes to metabolic systems, interaction of genetics, and things like that. These are all non-traumatic acquired brain injury. And even traumatic brain injury affects these systems too, and so it can cause secondary acquired brain injury, secondary type symptoms. So there is a great degree of interplay between these two, and that increases the complexity yet again. This is why a lot of people say, well, how come we haven't found an effective treatment, something that docs can give me now? Well, there are a lot of different conditions for acquired brain injury, and there's a lot of other injuries that occur at the same time, or over a couple days, weeks, months, and years. It isn't just that you have, bruising on your brain. If you have a traumatic brain injury, you've got inflammation, you have vasogenic reaction, you have like 15, 20, 30, 40 different things happening. This is why treatment's so hard. You can maybe target one thing, but then you've got 5 or 6 other things happening, and then maybe the medication you're taking then has a neurotoxic effect. This is why treatment is just so darn hard. Unlike a broken leg where, it's a fracture, some inflammation. Let's splint the fracture, or do surgery, fix it, give you an anti-inflammatory for pain control. You're good after a couple weeks. It is a single label we give to many, 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 many different processes, and over which not necessarily just one thing predominates. So this is why it is a complex chronic illness instead of a singular thing and a singular event. Not trying to rain on anyone's parade, and there are treatments always coming out. Maybe we will discover some things that we can do at least to help with the recovery side. But it also needs a splash of reality too, and that's really more what this is all about. All right, so finishing up that, so what you know comes next, the other, CTE. Just like pork is the other white meat, chronic toxic encephalopathy is the other, CTE, which we will be talking about acute and chronic CTE next. And this was just an overview of what encephalopathy as a whole is, and what our next discussion topic will be. All right, so if you have any questions, comments, anything like that, please share with anyone you think may benefit. And please click like, subscribe. Don't forget the bell icon. And if you have any comments you want for anyone else, again, down below. And we'll see you around. And please have a good one. Bye.